Good day, ladies and gentlemen, and welcome to the NCLEX Nurse Mechanic. Today, we'll be discussing the differences between cardioversion and defibrillation. Today, we'll be discussing the differences between cardioversion and defibrillation because I've realized that some of my students are confused between these two, right? Don't worry about the blank page because this is where we will be doing our notes, right? So, cardioversion and defibrillation, both of them, they transfer electrical impulses, right, or electrical energy to their heart with the hope of converting the abnormal rhythm back into a normal sinus rhythm, right? But then we're going to start by discussing what really is cardioversion, right? And let me just take out my pen, my favorite as usual, right? So I'm just going to write at the top cardioversion, right? So one thing that you must know about cardioversion, definitely you only cardiovert when your patient has a pulse. You cardiovert when your patient has a pulse, but then your patient must be presenting with an abnormal rhythm, with an abnormal rhythm, abnormal EKG rhythm, right? They are presenting with an abnormal EKG rhythm and they must be having a pulse, right? And definitely, if it's an abnormal rhythm, it means that they're unstable, isn't it? Your patient must be unstable, right? And why are we giving this cardioversion? We are giving the cardioversion, or we are doing the cardioversion because we want to correct the abnormal rhythm. We want to correct their abnormal rhythm, right? And there's just one thing I forgot to say before we can continue. I'm trying to type fast here. There's just one thing that I want to say before we can continue is to say that um remember, cardioversion, we have a pulse. Defibrillation, your patient does not have a pulse, right? And with your defibrillation is done in life-threatening situations, isn't it? And again, both the cardioversion and the defibrillation, we use the same machine. Both the cardioversion and the defibrillation, we use the same machine. That is what I wanted to add before I can go further because I did not want to forget that part. All right. Now, we continue with our cardioversion. Remember, when we talk about cardioversion, it's not just the name cardioversion, right? But then we used what we call it synchronized cardioversion. And when we talk about synchronized cardioversion, we are saying that we are synchronizing the cardioversion to the R waves. We are synchronizing the cardioversion to the R waves. Let me quickly draw my EKG strip here. Remember, we have the P wave, and then we have the QRS, and then we have the T, meaning that you are only going to cardiovert when you get to the R wave. Let me change the color. It means that you are only going to cardiovert when you get to the R wave. You must synchronize it to the R wave, right? Meaning that cardioversion must only happen when you get to the R wave. Because should you cardiovert anywhere, should you synchronize it to any other wave, your patient is going to complicate. They love this question in NCLEX. Your patient is going to complicate. They are going to go into what we call what? Ventricular fibrillations. They are going to go into what we call what? Ventricular fibrillations. So if they ask you the complication of cardioversion, especially if it's not synchronized to the R waves, what is it? They are going to go into ventricular fibrillations. I hope we are together. I hope we are understanding so far. I hope we're enjoying this lesson, right? And remember that before cardioversion can be done, you just don't say, oh, my patient is unstable, we need to cardiovert, let's get ready for cardioversion. No, TEE or TTE must be done. TEE stands for trans esophageal echocardiogram. TTE stands for transthoracic echocardiogram. TEE stands for transesophageal echocardiogram. TTE stands for transthoracic echocardiogram. So these are just done to rule out clots, right? Because cardioversion cannot be done if there are clots. So what I'm trying to tell you is if there are clots, no cardioversion, no cardioversion. If there are clots, no cardioversion. Why do we say no cardioversion? Because the clot can dislodge. Because the clot can dislodge, and if it dislodges, it's going to complicate. It can either travel to the lungs, causing a pulmonary embolism, or it can travel to the brain, causing what? Cerebrovascular accident. Then the clot can either travel to the lungs, causing pulmonary embolism, or it can travel to the brain, causing cerebrovascular accident, which is known as stroke. That's why most of the patients who present with cardiac dysrhythmias that will need cardioversion, they are mostly put on your anticoagulants first to say that if there are any clots, anticoagulants, they are mostly put on anticoagulants to say that if there are any clots, let's try and dissolve the clot. When we dissolve the clot, after it is dissolved, now we can do the cardioversion. Do you understand, guys? So remember, and they love this question again in your NCLEX. They're gonna give you a nice scenario. Maybe your patient is awaiting cardioversion, and then they are feeling weak, or they come up with something else. The fact that they're awaiting cardioversion, you ask yourself, has TTE or TEE been done? Or they're simply gonna say your patient is awaiting TEE, or they're gonna say TTE, and then they say that your patient now, they are presenting with severe signs and symptoms of decreased cardiac output. Are you going to cardiovert? No, we are not going to cardiovert. Please do not choose that option. It's a trap. Please do not choose that option. It's a trap. And lastly, when it comes to your cardioversion, because I think you would want to know the joules as well, right? They use minimum 50 joules, and then maximum they can go up to 200 joules, right? But then in summary, with your cardioversion, what you must remember is that cardioversion, it's done on a patient who has a pulse, their rhythm is abnormal, right? We are doing it because you want to correct the abnormal rhythm before it is done. TEE or TTE must be done. If there are clots, they cannot be cardioverted. You must put them on your anticoagulants, depending on your for how long. It depends on the healthcare provider, right? If you decide to cardiovert with the clots can dislodge, cause a pulmonary embolism, or cause a CVA, depending on where it is, right? And remember, back to your cardioversion, when we cardiovert, we use what we call synchronized cardioversion, meaning that you are synchronizing the cardioversion to the R waves. Because if you cardiovert anywhere else and not on the R wave, your patient is going to complicate and go into a ventricular fibrillation, which is now much more severe, right? And I know now some of you might be asking, let me just list a few for you. Let me just list a few abnormalities for you. Okay. The ones where we use cardioversion. Okay. All right. Example, cardioversion can be used in patients who are presenting with one, atrial fibrillation. I'm just going to list them for you, right? Atrial fibrillation, right? Two, ventricular tachycardia. Ventricular tachycardia, just to say a few, right? Just to say a few, ventricular tachycardia. Three, atrial flutter. Atrial flutter. Four, supraventricular tachycardia. Supraventricular tachycardia. Supraventricular tachycardia. So these are the few that I can tell you about. So this because I know that you might be asking yourself, but then we don't know this EKG or this cardiac dysrhythmias or this cardiac disorders. I'm definitely going to give you more classes slowly but surely about these abnormal EKGs. And I think for today, I'm going to stop here. So today we've discussed the cardioversion. So please expect the next video is going to be on defibrillation, and then we also put a nice summary of your cardioversion and your defibrillation. I hope you understood. I hope you enjoyed. Remember again, please don't forget to subscribe. Please don't forget to like. Please tell your other colleagues to subscribe and like. This is the NCLEX Mechanics. And like I promised, next week I'll be posting a video on defibrillation. And then after that, we can put a nice summary of the cardioversion and defibrillation, because I realized that if we did this all at the same time today, the time is going to be longer, the time is longer, and then you guys, you are lazy to watch videos that usually take a long time. Enjoy the rest of your day. Enjoy the video. Please don't forget to share and subscribe. Please don't forget my YouTube handle, which is NCLEX Mechanics. Thank you very much for listening and have a lovely day.